Aboriginal and Torres Strait Islander people suffer from major health disparities that ultimately influence negative health outcomes, especially for women in this population. Health Direct identifies that within Australia and the Torres Straits, there are various diversified tribal groups that follow individualized cultural practices, beliefs, and languages. Despite these differences, the entire population's health ultimately declined after Europeans colonized Australia, bringing with them their own culture, beliefs, and other influences that has ultimately affected Indigenous health. It must be noted that Aboriginal and Torres Strait Islander groups acknowledge health in a holistic manner, for not only individual health but community health as well. This holistic perception of health was lost when Westernised medicine began to dominate Australia. Cardiovascular disease is highly prevalent within the Aboriginal and Torres Strait Islander population, making it the third leading burden of disease for Indigenous women in 2011. The Australian Institute of Health and Welfare reports 7,100 Aboriginal women suffered from cardiovascular disease during 2012 and 2013, which equates to almost double the prevalence of non-Indigenous Australian women despite the major population differences.
Thank you, Ash, for the handover. I will be talking about heart disease in Aboriginal people. Heart disease can occur 10 to 20 years earlier among Aboriginal and Torres Strait Islander people. This is started when colonization took place on Aboriginal land and Aboriginal people. Colonial takeover introduced European culture managing native Aboriginal practices. This impact then caused the violence, disease, trauma, and disconnection from the country. Leading on, this introduced different foods to be involved, social and physical different activities, and the mental and emotional impacts, which led to health decrease. Colonization displaced many Aboriginal, leaving them to live in remote and disadvantaged areas of land, increasing the risk of heart disease. This is shown. They have limited access to health services, nutrition, and food insecurity because of the living in disadvantaged areas. This concluded that they have lack of fresh food, leading to diets with cheap and fatty processed food. Remote locations also cause physical and inactivity due to the geographic location. They were mostly in isolation and didn't have much around them, not much access to regular physical activity, not much regular access to healthcare. One of the major causes of increased heart disease or any increased trauma and problems in health decrease was integrational trauma, which is associated with the factor of colonization. It caused prominent levels of chronic stress, and the stress increased social inclusion, physical inactivity, bad diet, and lack of everything all around. I will be handing it over now to San.
So thank you, Sanya, for the handover. My part will be talking about the health services accessed by Aboriginal and Torres Strait Islander women. So barriers to Aboriginal and Torres Strait Islander people accessing culturally responsive, timely and appropriate cardiovascular care are significant. These barriers include differences in exposure to risk and protective factors, increased rates of comorbidity, and major gaps in the healthcare system. So there is a gap in the amount of cultural competency within the healthcare staff in regards to better serving the Aboriginal and Torres Strait Islander populations. Unfortunately, these communities often don't receive healthcare services that are culturally safe or that address their specific medical needs. Aboriginal and Torres Strait Islander people regard health holistically, addressing cultural, social, psychological, and physical well-being. This is far removed from the Western biomedical model, which views health in an all or none fashion, focusing on and sometimes becoming attached to the absence of illness and leaves gaps in care. In remote areas, services are not available in a critical way. Victims are often likely to be from a low socioeconomic background, and they often have difficult time accessing healthcare services close to home, making treatment less timely and effective. So the hospitalisation rates of 2019-2020, the Aboriginal and Torres Strait Islander age standardised hospitalisation rates for CVD was 1.6 times higher than for non-Indigenous women. And Aboriginal and Torres Strait Islander women in 2021 died from cardiovascular disease, with 22% of all deaths among women. Around 70% of Aboriginal and Torres Strait Islander women hospitalised for heart attack in 2020-2021 received percutaneous coronary intervention, which is also known as PCI. But they were 14% less likely to undergo PCI than non-Indigenous Australians. And in 2019-2020, Aboriginal and Torres Strait Islander women were 40% less likely than non-Indigenous women to have cardiovascular health assessments. So that's all for me for now. I'm going to pass it on over to Yui.
Thank you, Sen, for your invaluable input on the previous question. And now we will be highlighting the differences and the similarities between the population groups. Aboriginal and Torres Strait Islander and refugee Iraqi women both face displacements. Colonization forcibly caused Aboriginal and Torres Strait Islander women to abandon their traditional practices and adapt to Western lifestyles, which is similar to refugee Iraqi women who seek asylum in Australia after being displaced from their home countries due to war and poor living conditions. Cultural trauma and displacement are a key factor in negative health experiences for both Torres Strait Islander and refugee Iraqi women due to ongoing stigma, racism, and a lack of resources leading to limited access of health protective factors. Both groups face challenges when accessing specialized healthcare, such as longer waiting periods or inability to afford the appointments. Low socioeconomic status also leads both groups to stress, contributing to heart disease. Cultural differences are that Aboriginal women's health is tied closely to community and family views on health, whereas Iraqi women are influenced by migration. Aboriginal women experience racism due to colonization and historical trauma, whilst Iraqi women encounter discrimination based on cultural, religious, and ethnic differences. Aboriginal and Torres Strait Islander women are more likely to experience a lack of healthcare access due to socioeconomic status and geographical location, whilst Iraqi women are more likely to experience limited access to healthcare due to language barriers and social anxiety. And now we'll be passing it on to Ashley.
Paramedics are registered health professionals whose specialisation is providing emergency medical care to members of the public while outside the safety and security of a medical environment such as a hospital. Australia is a multicultural country, meaning that paramedics frequently experience interactions with a wide range of individuals, including culturally and linguistically diverse groups, such as Iraqi people and Aboriginal and Torres Strait Islanders. Paramedic education involves cultural competency to appropriately aid patients in a holistic manner, while also accounting for cultural beliefs and customs. Between July 2017 and June 2019, the cardiovascular disease contributed to 2.9% of all Indigenous Australian hospitalisations, which equates to roughly 18 Indigenous females per 1,000 population. Without considering gender, hospitalisation rates increased by age, resulting in Indigenous Australians aged over 65 experiencing the highest prevalence, with there being approximately 110 per 1,000 individuals. Socioeconomic factors faced by Indigenous communities in regional, rural, and remote locations makes accessing emergency healthcare a challenge. However, there are organisations such as the Australian College of Emergency Medicine who are working on improving a more equitably distributed healthcare workforce to address and elevate health outcomes for these populations.
Thank you, Ash, for the handover. I am the health promotion officer, and I will be talking about what health promotion basically is. Health promotion officers use a variety of skills to help individuals that are struggling with heart disease. One of the major focuses is the prevention, education, and support. Health promotion officers educate people on risk factors such as diet issues, smoking, stress, and lack of exercise that are the major causes of heart disease, which also provide manageable resources and routines to minimize the risks. Health promotion officers use advocacy and policy development to promote heart disease prevention programs, including exercise opportunities and access to healthy foods, particularly for groups with limited access to these. Promoting advocacy may be used through resource development, such as using pamphlets, apps, and websites to provide heart disease prevention tips. Health promotion also uses community outreach, such as creating health campaigns to raise awareness that target at-risk populations and explaining the importance of regular screenings and healthy living. I will be handing it over to Sam now.
So thank you again, Sania, for the handover. On my part, I'm going to be talking about my role as the support worker. So a support worker is an individual that assists other individuals that have mental, physical, or cognitive disabilities. A support worker helps these disadvantaged individuals to ensure that they can live independent lives so that they fulfill their potential. Support workers have a crucial role to play in supporting others to achieve holistic health through applying a mix of interpersonal, professional, and technical skills. The success of mediation often depends upon key interpersonal skills, communication, empathy, and trust building, to be able to understand and respect the unique cultural and personal needs of every client. Support workers are expected to be familiar with care standards, confidentiality, and have good organizational and problem-solving skills that would make it possible for one to offer care to patients in a more personalized way and effectively. These core competencies are what we call essential in supporting the physical, emotional, and social well-being of those being served. So that's my part, and now I will forward it over to Yui.
Thank you, Sam, for demonstrating the skills needed from a support worker in this mission. And now we will be talking about dietitians. So dietitians are health professionals who implement scientific knowledge of food and nutrition to empower clients with the enhancement of their health. This health promotion assists in prevention and treatments of various non-communicable diseases. reforming the health of individuals. Dietitians can also assist with targeting minority groups such as Aboriginal and Torres Strait Islander communities and populations. These strategies can be paired with other life alterations such as ceasing smoking, reducing alcohol intake, and introducing physical activity as a regular activity throughout the week. And now we will be passing it on to Nick.
Thank you, Yui. An exercise physiologist is a healthcare professional that delivers treatment for mental and physical health through exercise. They can design an exercise program that will best suit the patient's needs. Stress has been shown to increase the risk of cardiovascular disease. Exercise has been proven to reduce the risk of stress. Our multidisciplinary team, consisting of support workers, dietitians, exercise physiologists, and a paramedic and a health promotion officer, will be incorporating a 12-week program named Health Science Mission Program to educate Aboriginal and Torres Strait Islander and Iraqi women about cardiovascular diseases in Australia. The program will also address specific health issues regarding access to healthcare management and treatment of illness, evaluating trends and advocating for policy change and to support mental and social well-being in the listed population groups. After a 12-week program, the support worker will revisit the questionnaire and determine if the health literacy has been developed or improved. Support workers will first test health literacy in the form of a questionnaire before the program begins. A support worker will meet needs to provide culturally safe and responsive healthcare services to Aboriginal and Torres Strait Islander women to understand and respect their cultural values, beliefs, and practices. Support workers will also be training healthcare providers with cultural competencies so that they can communicate and engage effectively with Iraqi women. They should learn about the historical and social context influencing their health as part of this training. Exercise physiologists will work to develop an internal program within the mission to cater to Aboriginal and Torres Strait Islander women and Iraqi women with cardiovascular disease in Australia. They will promote women community walks with other people from their group to prevent fear of discrimination, offer Iraqi women a female exercise physiologist to feel more comfortable and increase the participation. Dietitians will reduce the risk of heart disease caused by nutrition in different population groups. Multiple factors such as cultural and socioeconomic aspects must be explored. In the suburb of Blacktown, approximately 3.4% of the population suffer from heart disease. 3.3% include Aboriginal and Torres Strait Islander women. To target this issue, dietitians can modify traditional cuisines and current diets of Aboriginal women with healthier ingredients whilst acknowledging cultural and socio-economic factors. These dietary modifications can be provided to the Aboriginal and Torres Strait Islander women in Blacktown through community gatherings funded by government for an opportunity to improve the health literacy and reduce the risk of heart disease. Refugee women from Iraq will in suburbs such as Fairfield have high rates of heart disease due to factors such as low access to nutritious diets and food insecurity in their country of birth. Health districts local to Fairfield provide educational programs to increase health literacy with the help of Arabic-speaking workers to overcome language barriers. By incorporating dietitians in these educational programs, healthier recipes of traditional cuisines and dietary advice can assist in reducing rates of heart disease in Iraqi women living in Fairfield by enhancing health literacy. As a health promotion officer, advertising our health science mission program for this advertisement will be done in specific areas and are filled with the population we are targeting, such as Blacktown for Aboriginal and Torres Strait Islander women. As health promotion officer, I will be advocating the strategies as well as different services for our program. We'll offer such advertising our dietitian and exercise physiologist, healthy meal plans, and community walks. I'll be using flyers and handing them inside the Blacktown community, such as malls, food places, and placing posters in billboards, as well as trying to use social media as a platform such as Facebook, Instagram, and TikTok. I will also be advertising our support workers' information on places, steps, and on cards and posters, as well as social media on how to minimize risk management and treatment. Advertising the program will be catering to Aboriginal women. To do this, we have brought in a well-known Aboriginal woman, Jessica Malboy, who will be promoting community walks with other women to encourage less fear within the group and promote motivation and exercise. This program will also focus on Iraqi women. As a health promotion officer, I'll be advertising our program in Fairfield area to deliver the much Iraqi population as I can. The program will focus on making women feel comfortable according to their cultural personal beliefs, such as including introducing a women-only walk, women-only gyms, as well as women health professionals. Paramedics' involvement in the health science mission program will ensure the safety of participants throughout the 12-week schedule. Assessments of participants' vital signs and overall cardiovascular health will be conducted before commencing a week one, and again after engaging the full program to allow comparison of health results. These face-to-face assessments will be explained to participants in an appropriate manner to aid in the improvement of health literacy throughout the 12 weeks. Paramedics will be on standby to assist any potential health emergencies. Having universally known, identifiable health professional assisting may also reduce the amount of stress and participants may feel. Thank you for listening.